The aim of the film is to provide a refresher on the skills of changing a suprapubic catheter. As this is a refresher of the skills, we're expecting that you've completed the full face-to-face training and competencies. You will need to understand the relevant anatomy and physiology, so please refresh this if required. We will not be covering this in detail. Before you start, ensure that you're familiar with the Gloucestershire Health and Care urinary catheter policy. There are a number of action cards within the policy that should be used. There is one for changing a suprapubic catheter, and there's a separate one for removal of the suprapubic catheter. It is vital that you work within the level of your competence at all time. The indications for having a suprapubic catheter is if the patient's in urinary retention, there's an inability to pass the urethral catheter due to obstruction or abnormal urethral anatomy, trauma to pelvis or urinary tract, if the patient's not able to tolerate a urethral catheter because of perhaps acute prostatitis, following complex surgery such as urological or gynecological, the need for long-term catheterisation for those who are sexually active, or continued expulsion of the urethral catheter. The suprapubic catheter is usually replaced with one of the same size. The policy does state that you should be using a catheter no less than a 16 gauge Foley catheter. If you do use anything smaller, then please document this and give clear rationale of why you're using that. If the patient has a catheter valve, ask them not to empty their bladder for about half an hour before the procedure so that there's a urine in the bladder. Encourage oral fluids to facilitate bladder filling. If the patient does not have a catheter valve, ideally one should be used to ensure that the bladder is partially filled during the catheter procedure. However, we appreciate that sometimes this isn't possible. A couple of things to remember: if you're not able to deflate the catheter balloon, inform medical staff or the GP. A member of the urological team can be contacted for advice, but never cut the catheter. It's important to remember to synchronise removal and replacement of the old and the new catheter carefully. This must be done without delay to avoid closure of the insertion site. If the patient has spinal injury and is at risk of autonomic dysreflexia, ensure you do a full set of observations before and after the procedure. I've explained the procedure to the patient and I've obtained their informed consent for changing the suprapubic catheter. I've checked for any allergies and I've offered the patient a chaperone. I've now helped them to get undressed and comfortable on the bed. In relation to their clothing, their tuck button of their trousers just needs to be undone and maybe they're flat open, and they need to be able to expose their tummy. Okay. I'm now going to just uncover the patient just so we can see their area, and I'm going to detach their catheter bag from their leg in preparation for changing. Okay. I'm now going to go and wash my hands for the designated 30 seconds, and then I'm going to come back and prepare my fields. So I'm going to clean my area with some Cornell wipes. And then I'm going to check my catheter pack, ensuring that we've got a stranded length catheter. As I said, it needs to be the same size as the catheter that's coming out, but the minimum of 16. If it does need to be any less, then that rationale has to be documented on System 1. I'm checking the expiry date, and I'm also checking the lot number and the reference number there, so we can put those details on System 1 afterwards. Be aware that the gloves in these tend to be quite small, so if you have got larger hands, you may need some separate sterile gloves of the appropriate size. If you haven't got an apron on, At that point you can actually put one on now. Okay, so at this point you need to put on your first pair of sterile gloves. I now put on the towel. And then using one of the gauze, so we have an empty syringe to deflate the existing balloon. We have two 10ml syringes of sterile water for cleaning purposes. We have a 10ml syringe of sterile water for the new balloon, and we have a syringe of lubricant. If your patient does require anaesthetic, local anaesthetic lubricant, then that needs to be prescribed. Okay, so at this point what we will do is we need to clean the area. So we're going to use some of the sterile water and we clean around the existing suprapubic catheter. Okay. One sweep and then away, and then repeat the process. Okay. What you can do is if you put some lubricant on your sterile field, and that's for the tip of the catheter. If you are using anaesthetic lubricant, then it's really important that that anaesthetic lubricant goes around the site of the stoma and into the stoma as well. Okay, just to give the patient relief, it needs to be in position for 3 to 5 minutes. You would deflate the balloon. Be aware that these balloons do hold 10 mils of water. But over a period of time, a small percentage of that may be absorbed through the balloon, so just make sure it's completely deflated. If you've got a balloon that's silicone or silicone coated, then make sure that you leave that for 5 minutes to ensure that it fully deflates. At this point, you would remove your sterile gloves and wash your hands for a second time for the appropriate period of time. Once you've got your sterile gloves on, you can then take your second towel, okay, which is going to create the sterile field. So if you tear this and put it around here, remember you had a sterile gauze there. You then take your second catheter out of the pack. Remember, if it's got a red seal on, that doesn't need to be changed. The bag doesn't need to be changed for a period of 2 weeks. Please put your date on for the next change. If it hasn't got a red seal, then these bags need to be changed on a weekly basis. So the next thing you're going to do, you've got to be prepared that once you remove your one catheter, that you're ready to insert the second. Put some lubricant on the end of your catheter, okay, and bring it up. And the idea is that you need to remove the old catheter and insert the new catheter within a very small period of time. Observe the track that the old catheter is going on, and what you also need to do is to gauge the length of the catheter that's actually in the skin. Okay, so hold it close to the skin and remove it, and look for signs of crustacean on there. Okay, but also gauge the length that's in there. You're then going to insert it along the same track to the same sort of length. Okay, and then once you've done that, you're going to inflate the balloon. If there is any resistance, then all you're going to do is just press it in, push it in a couple more centimetres and inflate the balloon just very gradually, full 10 mils. And then slightly retract it until there's some slight resistance. Okay, and then that's your catheter changed. At that point, what you can do is, with the gauze swabs that you've got left, you can just clean up the area. Make sure that the patient is nice and comfortable and there's no pain. Observe the urine coming out of the catheter, and if there's no urine visible initially, then get them to sit up and allow a little bit of gravity as well. Once you've done that, you then need to attach the device, the fixation device. Just onto the legs. You have got a skin preparation pad in the fixation device. Just make sure that you do use that and allow it to dry before attaching the fixation device. Once it's dried, just attach it, and what you'll want to do is put it on the top of the leg as opposed to the inner part of the leg, because you don't want there to be any chaffing or irritation. And then just insert that into the fixation device. Okay. And then you can fix it onto the leg. Remember, you have got these bands that come with the catheter pack. When you do this, make sure that when you fit the bands onto the leg bag, that the bands go behind the tubing, otherwise there's a risk of occluding the flow of urine into the bag. Okay. And then you can fix that onto the leg. And then you've got a secondary one for the lower half as well. Make sure that your patient's nice and comfortable. You don't need to put a dressing on over this, just make sure it's nice and clean and there's no signs of infection. Not at all. It's important to check the tip for the old catheter and check that the tip and the balloon are intact. Also be aware if there are any signs of incrustation and the extent of the incrustation. If there is any signs of incrustation, think about how long the catheter has been in and whether you need to start bladder installation regime. Also think that if there is any incrustation there, that on removal of the catheter there was a risk that you could have caused some trauma or scarring to the suprapubic site. For documentation, make sure that the procedure is well documented and the catheter passport details should include things like the date and the time the catheter changed, the type and makeup of the catheter, the size of the catheter and the balloon size, the lot number, details of the procedure, whether there were any difficulties encountered, the colour and the amount of urine drained and the drainage system used. Please can you ensure that you document this in the catheter passport and the clinical record.